Hello, welcome to this very unique town hall. We are live streaming live from Milford City Hall to provide additional information, additional details for our city operations, our community, and our Milford Public Schools as we respond and reinvent the way that our community deals with the COVID-19 pandemic across the city, the state, our nation, and the world. First and foremost, I am blessed to be here with two of our community leaders, our Superintendent of Schools, Dr. Anna Kataya, and our Director of Health, Deepa Joseph, who have stepped up. Tremendous kudos to each of them for all the good work and hard work that they have done to keep continuity of our schools and our community's health. This is really unprecedented. There is no playbook that we've been able to lean on or rely upon. What we have been leaning on is the best information that's out there. Our community health experts and experts across the spectrum, and we've been using this to inform the best decisions that we can. It's been difficult for everyone just because our way of life has really been adjusted. It's been flipped on its head, and we are trying to find new ways to eat and to recreate and to go to school. So it has affected each and every one of us in our community and communities all around our nation and the world. And before we move forward, I know that we are going to have some questions coming in from residents, but before we move forward, I would like to take an opportunity to introduce both our Superintendent of Schools and our Health Director to provide us an update for our schools and an overview of our community's health. So without further ado, Dr. Kataya.
Thank you, Mayor Blake. And I'm happy to provide an update on what Milford Public Schools is doing to respond to the change in how we live our lives and how we school. But first, I'd like to start with a recognition of how incredibly different this is for all of us. This has certainly changed the way we live and interact at home and with one another. And it's really important that with our young people, we recognize the feelings that they may have right now. With the loss of normalcy, the loss of connectedness, it's really important that families are talking about this at home. And we are happy that our staff are online, our school counselors, our teachers, our administrators, to help respond to that and support families in any way. So while we are first and foremost an academic institution, we also need to prioritize during these times the mental health and well-being of our young people and families. So please take time to love on one another and care on one another much more greatly than getting to the assignment or task that's been posted on Google Classroom. Albeit it's important, but please make sure that you engage in self-care and caring for those in your household. With that said, please know that I, along with our leadership team, are in regular communication with the Commissioner of Education, Dr. Miguel Cardona, as well as the Governor's Office. At least weekly and more, we are in conference calls at the state level, getting day by day, sometime hour by hour, updates on policies and legislation that have been altered in order for us to more, in an expedited fashion, respond to the needs of our young people. With that said, we are rolling out a 3-phase distance learning plan in Milford. Yesterday marked day 1 of phase 2. So while phase 1 was a bit more of a passive online opportunity that students took advantage of, yesterday became much more interactive through Google Classroom between teacher and student. We will spend the next couple of weeks in hopes to go live with phase 3 around April 13th after we get back from spring break, with a much more robust interactive platform between adult and student, so teacher and student online. More information will come to you I'm so grateful for everyone's understanding that we basically took an entire school district online with given about a 7 to 10 day window. So as these phases of distance learning are developed, you will be hearing more from my office, from your school principal, from your school teacher. With that said, we also have Chromebooks available. We have issued many more Chromebooks for all students preschool through 12th grade. While we did start as a one-to-one school district in grades 3 through 12, we're happy to announce that we distributed just in the last week about 500 more Chromebooks. If you are in need of a Chromebook, please feel free to contact our offices. You can get a contact information on milforded.org to request a Chromebook for your child, any grade, preschool through 12th grade. So the big question is, and a lot of misunderstanding out in our community, at least, and across the state, is what about the 180 days requirement to complete a school year? Our governor have waived that requirement. So therefore, the official last day of school for Milford Public Schools is June 11th. The last day that was scheduled prior to this pandemic hitting our community is the day that will be honored as the last day of school. So for Milford, it will be June 11th. So recently, just as recent as yesterday, the governor announced a new mandatory closure of schools. While he anticipated that to be through March 31st at one time, he has pushed that out to at least April 20th. I'm sure you're hearing the rumors, as I am, as Governor Lamont has been talking publicly about potentially not opening schools back up this spring. Please note that that is not an official decision. That at this time, Governor Lamont has closed schools through April 20th at the very least. We do get regular updates on that, though, and or the governor's office obviously will be notifying parents if that date changes. So big question on a lot of people's minds, rightfully so, is when will graduation be in Milford Public Schools? That is a decision made by the Board of Education. The Board of Education will be meeting virtually on April 13th to discuss that date, and we'll be happy to publish that information as soon as the board has decided on those dates. If you haven't already signed up for receiving meals, we are offering breakfast and lunch to any student of the Milford Public School system. Those meals can be picked up at Jonathan Law High School between 9:30 and 10:30 on Tuesdays and Thursdays, or East Shore Middle School from 10 to 11 a.m. Just today, I'm happy to share that we distributed breakfast and lunch to 500 students, equaling 1,000 meals distributed just today. So we are providing this great service to our community because we know that there is a need. So please feel free to reach out. Go to our website, again, milforded.org, to get more information on how to sign up to receive meals. We just this week received information from the College Board notifying us that any and all SAT makeup dates for March are canceled. Statewide SAT Day is canceled as well. They're hoping to offer a makeup date, if not this spring, sometime this fall, for students to take the SAT. AP exams will continue. The College Board will be releasing information in the next couple of weeks on how this will occur, but the plan right now is for students to take the AP test through an online at-home exam. It will range for about a 45-minute at-home exam. Special prep opportunities, video tutorials will be released by the College Board as well. You can always go to collegeboard.com or org to get more information on AP and SAT testing. And I think those are all the updates from the Milford Public Schools at this time.
And Deepa, how about some updates in terms of our community's health?
Good afternoon, everyone. So as far as the public health situation with COVID-19. Where we are today in Milford is that the health department continues to work on a few different things. One, first and foremost, being keeping an eye on cases that we have in Milford that are confirmed as positive and doing contact tracing for those cases. So as of this morning, we currently have 6 positive coronavirus cases in Milford, and so the health department has followed up on each of those cases, identified potential contacts, made appropriate notifications, and is just ensuring that those who are positive and contacts of those are familiar with all of the instructions specific to self-monitoring, staying at home, knowing the length of time that they need to stay at home, and we continue to be in daily contact with those individuals as well as contacts. In addition to that, as is really our daily mission with focusing on prevention efforts for everything, our goal is really to continue the messaging out there for our community of making sure that everybody is taking the preventive measures that we need to take, with a tremendous focus on social distancing at this time. So as you all have heard, about ensuring that when people are going out to do things, that it really should be making trips that are essential for food, for medication, or critical needs such as that, or if you are still reporting to work, what the health department staff is working on is providing guidance to businesses, organizations, and other agencies as to how to continue to safely operate amidst this virus that we have going around. So we continue to encourage everyone at home that even though you're in your home space and you are not necessarily going out as much as you were before, you still need to be diligent about practicing those preventive measures. You need to be washing your hands for 20 seconds, often with soap and water. You need to be making sure that even within the household that you are regularly cleaning and disinfecting the high-touch surfaces, and that should really be something that's done on a daily basis. And then if you are experiencing symptoms or you've come in contact with someone who's experiencing symptoms and you're not sure if you've been exposed, we encourage everyone to call your healthcare provider. Please do not go to your healthcare provider's office directly or to the emergency room directly, but rather call ahead so that they can do an assessment virtually through a telehealth consultation if possible or over the phone, and then determine what your next step should be. And definitely if you're feeling symptoms, please stay home except to get medical care that's been approved, that's been pre-authorized. So that's really where we are, and the health department is fully operational and available to answer any questions that you have, so please feel free to call us at 203-783-3285, and all of our staff is there. If you're concerned with any questions that may not get answered today, we are there to provide as much guidance as possible based on the information that we know at this time.
And thank you to Deepa, and thank you to Dr. Anakataya for all the good work that has been for each of the departments over the last couple of weeks as we have adjusted our lives. At this point, Kathy Bonetti from Milford Public Schools did have some questions that she received from residents and the public that had called in or emailed in with some inquiries about the state of affairs.
Thank you, Mayor Blake. Let's start off with the first one, and you may have indirectly answered this already, but how is the city responding to the COVID-19 situation at this point as far as city operations?
Obviously, everybody's lives are changed. The message that we're trying to put out in the city is a positive one. Stay healthy, stay active. Make sure that you are embracing social distancing. Make sure that you're doing everything that you can to keep our healthcare system sound, which means that you are taking those precautions to stay at home as much as possible. to make sure that you're washing your hands, which is what Deepa said, and making sure you're practicing good respiratory health. But we also need to do that on a community basis. We need to make sure that we check in on those that are the most vulnerable, especially our friends and our relatives and our neighbors that are seniors, making sure that they have the resources that they need to stay healthy, whether that's a meal that can be dropped off at their house or just some positive interaction with them through text messages, a phone call, to make sure that those people that may not have the other opportunities that younger, healthier people have are getting taken care of. Also to make sure that our business community is supported. This is having a huge financial impact on individuals, on employees, and our local businesses. Our businesses are being tested, and the best thing that we can do from an economic standpoint is to support those local businesses, to shop at our local stores, those that remain open, to support people who are struggling right now, and to make sure that we frequent those restaurants, takeout and delivery restaurants that we still have in our community. But above and beyond everything, make sure that you take care of yourselves. Make sure that those good practices for health are being followed. And with that, there's a lot more, but those are the things that we're trying to do at the local level to make sure that we stay positive and healthy.
Thank you, Mayor Blake. The next one is for Director Joseph, and that would be, what are the COVID-19 symptoms? What are the signals that people should be looking for to wonder if they do have the virus?
Thank you. So COVID-19 is a respiratory illness, and the primary symptoms of it are fever, cough, or shortness of breath. So anyone experiencing those symptoms should contact their healthcare provider. And specific to the fever, even if you're thinking that you're experiencing a low-grade fever, that is still worth making a phone call to your healthcare provider.
Thanks, Deepa. The next one is one we've heard a lot at Milford Public Schools. So Dr. Kutaya, how can I better assist my child with distance learning? That's a frequent one.
So distance learning for most of us right now is a new phenomena. And so I believe that approaching distance learning like it's almost the first day of school and ensuring that you try to normalize your home environment into something that is a cross between a school environment and a home environment, certainly, by helping your children establish routines, setting up a sort of a regular schedule, albeit doesn't have to be black and white by the minute, but just establishing a regular routine that's predictable for your child, and a regular wake-up time, a regular break time, regular lunch, regular close of day time, regular time to eat meals together and get outside and get some fresh air. So establishing some consistent, predictable routines is really the best way to support your child. And also understanding that, just like at the beginning of a school year, your child has to get acclimated to a new classroom, new friends, new teacher, new hallway, new school potentially. While those individuals are familiar to your child because they've been going to school together all year, it's a different platform. They're not seeing one another face to face. Imagine yourselves, think about how different that is for you to primarily communicate with others via FaceTime or Zoom or Google Meet. It just doesn't feel the same in many ways. Know that your child is experiencing those same feelings. And so I think to be patient with the learning curve with your child, that they may not jump right back into schoolwork like they did at one time. While they may have been a very diligent, responsible, studious individual, it may take time for your child to get back into that groove. So being patient and really understanding the affect side and supporting your child's emotions and an approach to learning digitally, I think are some of the more critical ways to support your child. And then the typical structures of schooling still apply. If you see that there is a difficulty that your child is experiencing, email the teacher. And keep those lines of communication with your child's teacher open to follow up, to really determine how, as a team, you can support learning. Because know that there's a lot of learning going on the adult side as well as the child side. And I mean adults at home and adults at home who are doing the teaching as well. So those are primarily the ways to support students during this process.
Thank you, Anna. The next one, Mayor Blake, this is one I've heard a lot personally in my own home. With the closure of playgrounds and basketball courts and other recreation places, what safe activities can Milford residents take part in?
First and foremost, a big part about fighting any kind of disease is to stay healthy, stay active. Make sure you're getting a lot of exercise because that boosts your immune system and helps fight off any kind of disease, whether it's the common flu or what they've told us about COVID-19. So we don't want people to stop exercising. We want people to get out and about. We have some beautiful open spaces, the best beaches in the state of Connecticut, great walking trails. We want folks to take advantage of those, to utilize those. We have, however, closed down our playgrounds because, again, they are tight, confined spaces. They don't allow for social distancing. We've also just recently put signs up on our tennis courts, our pickleball courts, and our basketball courts, again, asking people to avoid those because they don't allow for social distancing. But there's still endless opportunities to get exercise, to get out, to recharge your physical bodies, take advantage of all that Milford has to have, especially as the weather is getting nicer. Today it feels like spring, and so make sure that you utilize all those great walkways and pathways. We have great opportunities to run and to bike and to take a walk in a responsible way while staying away from others.
Great, thank you. This next one is for Director Joseph. Do we have a testing site in Milford, and how do I get tested?
Thanks. So currently we do not have a testing site right in Milford, but we are very close to having one. We anticipate that one will be opening up potentially in the next 24 to 48 hours. Aside from that, though, the way to get a test is that you cannot just walk up anywhere and just get a test. You do need to have a physician's order to get a test. So the best option is to call your healthcare provider. Once they make an assessment that you need a test, then they will be able to send an electronic order to the testing site, and then you'd be able to get a test. Your other option, if you don't have a healthcare provider, a primary care provider, you can also call the Yale New Haven Health hotline, the COVID-19 call center, which the number for that is 203-688-1700. They will be able to also provide a consult and then order a test if one is deemed necessary.
Great, thank you. This is another one for Director Joseph. Excuse me. What is being done to ensure that the takeout delivery restaurants are following safety guidelines, as we're all using them now? So,
that's a great question, and we do get a lot of phone calls at the health department about that. So we have sanitarians who work in our office who on a routine basis are responsible for the inspections of food service establishments throughout our community. So our sanitarians have been working very hard to contact every single food service establishment in our community to evaluate how those establishments are converting to a takeout-only, delivery-only model and ensuring that they're following the guidelines and doing it in the safest possible manner. We do know that there are some spaces that are, they might be smaller, they might be tight and not allow for social distancing for individuals to come into the space for the takeout. So we're really working with establishment owners to put in plans that meet the guidelines and that allow everybody to take advantage of the great local establishments that we have and the takeout and delivery option in a safe way. So we are happy to answer any phone calls from anybody on that.
Thank you, Deepa. Mayor Blake, what services, such as trash, recycling, pickups, road repairs, what's still being offered by the city at this point?
Well, trash and recycling are continuing on as normal, as are almost all of our other city services. Certainly fire and police, our first responders are fully operational. Public Works is maintaining our infrastructure and doing the necessary functions that they deliver to us. The health department is full strength, as are most of our city offices. However, there are some changes. We are encouraging all residents to call in or utilize the online services that our city operations already allow for, whether that's at the city clerk's office or the finance office or the tax office, to make sure that you call in or you utilize those services on our website, www.ci.milford.ct.us. If you have any questions, certainly can call the main number at 203-783-3200 and inquire with any of our departments. All of our departments are operational, but the buildings like Parsons Government Center is by appointment only, and we're encouraging everybody to make sure that you try to avoid coming in to that building, at least for now, and try to utilize the online services. The library is closed. However, the staff there are doing fantastic work to offer online opportunities for people, even going so far as to do online story hour. So there's a lot of neat opportunities there. Utilize the library's website. Our senior center also has shut its building, shut its activities, but they are offering some services. They are offering the Meals on Wheels program still. The food pantry is still operational, and their mini meal program is, again, still operational, but it is in a to-go format. Between 11:30 and 1, I believe on Mondays and Thursdays, they will be offering their mini meals to go. They'll have packages of, I think, 3 meals at a time, so that people can take advantage of that as well. Please call in to the senior center before you come down to make sure that they have enough inventory, whether that's the mini meal program or one of the other programs that they're offering. But certainly I'm always happy to direct people in the right direction if they have questions about city operations. My number, 203-783-3201.
Great, thank you. This next question comes in for Dr. Kutaya, and it's, are teachers moving to Google Meet or other video conferencing to conduct classes?
Great question, thank you. So we anticipate more Google Meet interaction between teacher and student in phase 3. So while there is some of that occurring right now in limited fashion, the phase 3 plan is to increase live teacher-student interaction. So yes, that is the direction we're moving in.
Thank you. This question actually might be answered by each of you. Is there some kind of a setup where people in their good intentions want to donate things or donate medical supplies or foodstuffs? What is the city's, what is our plan for people who want to donate things to the various departments? So Dr. Kutaya, I don't know if you want to go first or...
Well, at this time, we don't have a system where we'll be taking from the community to distribute out. But as a superintendent organization at the state level, we are looking at potentially, since our buildings are closed right now, utilizing current supplies to gather them up and send them out to local hospitals and/or medical facilities. So there is a process in place that is just getting started at the state level that will organize all schools to help do that. So that's primarily a school to medical facility donation process. I don't know if the town has another process they're thinking.
For medical supplies, there is a process through DEMIS at the state where they will vet whether or not some of the donations that are coming in or for sale items, medical supplies, are legitimate. They're asking our local health departments to do the initial vetting and then pass it up the chain to see whether or not those items are, one, needed and two, legitimate. But at the local level, if folks want to donate food, certainly our food banks are always welcoming that. The Senior Center is one food bank that I've already mentioned. I know that our animal control office, our animal shelter, is always accepting donations for our cats and our dogs and our pets as well.
And also, in addition to that, 211 Connecticut is also, there is a link on their website. If you are interested in making donations, there's an opportunity there to click on the link, enter your name, your contact information, and what supplies you're interested in donating, and that also goes to DEMIS as well to review and get back in touch with you.
In one area of need that we've been hearing, the Red Cross, their blood supplies are low. They have stepped up their game in terms of protecting individuals' health, but the blood supply is low. So if anyone who is able and willing to donate blood, we are asking everybody to contact the Red Cross and make an appointment.
That's a great reminder, thank you. We just have a few more questions. This one, I believe, would be for Mayor Blake. What is the city's response to groups at the beaches, and what are we doing to keep public spaces sanitary?
Our Public Works Department, the building division has really stepped up. They're cleaning on a very, very regular basis all of our city buildings, especially our high-touch areas, doorknobs, light switches, things of that nature. They're constantly going through the buildings. But in terms of our parks and our beaches and those areas of congregation, we are asking people, we are pleading with people to exercise sense, not common sense, because common sense would bring everybody together. We're asking people, if they're going to come together, to please stay 6 feet apart. This is something that we have learned from other countries that had a few weeks head start on us. The only way to control this and to flatten the curve is to stay apart, to social distance, to make sure that there is a buffer between you and your friends or neighbors or anyone, because that's the only way that we're going to reduce the impact and help mitigate this disease.
Thank you all. I believe we are good with our questions. Perhaps each of you would like to have a wrap-up at the end, a concluding statement. So perhaps Director Joseph, if you want to go first.
Thank you. So at the Health Department, we just want to encourage everybody to wash those hands, clean those surfaces, stay home if you're sick, call your health provider if you're sick, and to really take advantage of the time that you have at home and try to think about it in a positive way and just really enjoy the time that you have at home, maybe catch up on those projects that you had on the back burner, and just make sure that while you are doing the essential things that you need to do, that you are taking the steps to protect yourselves and protect others around you.
My message is just for everybody to stay healthy, stay positive. I do want to take an opportunity to thank all of the people that work for the city of Milford who are putting in long hours, putting of their time and the resources and their energies to make sure that at a city level, we are doing everything that we can to protect the health of the community, to make sure that we get the business of the city, especially that critical business, accomplished in a way that doesn't jeopardize anyone. So to the people that work for the city of Milford, our health department, our schools, our public works, our police, our fire, all of our city employees, please know how grateful I am.
And in that vein, I'd also like to thank the incredible staff of Milford Public Schools, those who are working remotely, and those who are still in our buildings working. We have custodians cleaning, waiting for the day that we fill our school buildings back up. And we have food service department that are preparing meals, thousands of meals. Last week, we served 4,000 meals, and our guesstimate this week is that we'll be serving 5,000 meals. So there are people still working very, very hard for our young people, our community here in Milford. So I want to send a huge shout out. And also want to recognize that we don't have this all figured out. We are learning side by side. This is the first pandemic that we've dealt with as a school system that shut us down completely, almost completely, at least in bricks and mortar. So I want to thank families who are patient and potentially some days are frustrating and heartbreaking and hard to get through. And I want you to know that you're not in this alone, that we are doing this together, we're learning side by side, and we're welcome to your feedback, open to suggestions on how we can make this smoother for students and staff and family. And I believe that we are going to rise up from this victorious, that we are Milford strong, and we are going to do this together. So thank you for doing this with us.
Stay healthy, Milford.